Hello, it's Patrick Burns. It's December 8th, 2019. And for the Unit 4 case connection assignment, I will be answering case number 1 and case number 3. So I'll start with case number 1. In case number 1, we have a newborn girl who has appeared to develop lethargy, hypothermia, and apnea. The physician orders a number of labs, and the results are that the initial blood ammonia level was elevated, urine uric acid level was elevated, and plasma citrulline level was normal but seemed to be on the lower range of the acceptable range. So this seems like one of our examples from the urea cycle regarding different levels of ammonia, uric acid, and citrulline. From our lecture in week 13, we learned that elevated levels of urine orotate would suggest an increased production or an increased accumulation of carbamyl phosphate. An increased level of ammonia in carbamyl phosphate would suggest that carbamyl phosphate synthetase is active in producing carbamyl phosphate. Sorry if I'm not pronouncing that correctly. But since citrulline levels are relatively low, this means that the pool of carbamyl phosphate is not being used to synthesize citrulline. So it appears that the enzyme that is most likely to be impaired in this situation is ornithine carbamyl transferase. This is characteristic of ornithine transcarbamylase deficiency, or OTC, which has high levels of urine orotate, being high, blood citrulline being low, and blood ammonia being high. In our lecture, we also learned that in a situation like this, the elevated carbamyl phosphate is used in pyrimidine synthesis in the cytosol, which will result in high levels of orotate. So since elevated levels of carbamyl phosphate are present, the least likely enzyme to be impaired is carbamyl phosphatase synthase 1. So with regards to which diagnosis would be best to distinguish between a urea cycle disorder and a beta oxidation disorder, it would be D, plasma glutamine. Glutamine is a non-toxic and also a non-essential amino acid, which helps with the transportation of ammonia. In a urea cycle disorder, glutamine levels can rise due to elevated ammonia levels, which is also what happened in our situation with the little girl. However, glutamine levels in beta oxidation disorders tend to remain at normal levels. So that concludes my answer for case number 1. So case number 3, funny enough, kind of reminds me of an elementary math question with the patient drinking 4 to 5 liters of soda a day. It reminds me of one of those questions along the lines of John eats 20 apples a day and Susan eats 15 apples a day, etc., etc. I don't mean to judge anyone, but how and why are you drinking 4 to 5 liters of soda a day? Anyways, in our case here, a 4 to 7-year-old man presents with severe pain in his toe, and he cannot bear any weight on it. There is no apparent trauma, and after a physical examination and lab findings, he is diagnosed with gout. The lab test shows that the patient has elevated levels of plasma urate and decreased levels of urinary uric acid. The most likely reason for gout is a dietary modification from diet soda to regular soda. As stated in the prompt, the primary sugar in most regular sodas is fructose. And fructose increases uric acid production since fructose can be converted to purines. The increased levels of uric acid can then cause gout. So the first option, overproduction of purines, is not technically correct, because even though there are elevated levels of purines, it's not overproduction because it's through the diet and not being specifically produced by the patient's body. The second option, decreased salvage of purines, is not correct either, because even though decreased salvage of purines can lead to gout, like in Lesch-Nyhan syndrome, sorry if I did not pronounce that correctly, it is most likely due to the diet change and not a deficiency in an enzyme. So the third option is the correct choice, decreased urinary excretion of uric acid. The patient's lab tests show that there are decreased levels of urinary uric acid, and this is consistent with the third option. So the decreased urinary excretion of uric acid is the correct answer, since uric acid is being accumulated in the body and not being excreted. And that concludes my answer for case number 3. and for the unit 4 case connection.